Welcome. My name is Elese Steeple. I'm an advisor with McMillan Wealth Solutions. You don't see too much of me, but this is the first one I've done. First one being a podcast I've done for Kathy. We're here today talking about one of the things that I'm very passionate about, an item that Kathy's very passionate about, is our health. And I'm joined today by Dr. Johnathan Bastian. He is the medical director at Aeon Future Health. And welcome.
Yeah, thanks so much for having me.
Johnathan, explain a little bit how you got into this field of medicine and what you actually are able to do for your patients.
Yeah, sure. So before the Aeon journey, I had two roles. I worked in the hospital at the Peter Lougheed as a hospitalist. And then I also worked at urgent care downtown at the Sheldon Schumer here in Calgary, and then also in Cochrane. And what I found is we would have really good treatment plans and diagnoses and medications for patients once they came through the door and they were already sick. But as I saw that more and more and more, I started wondering what, if anything, can be done before that to sort of prevent that occurrence coming through the urgent care, the emergency department, or the hospital. And that sort of began a journey towards trying to figure out a way to provide more preventative care focused on health optimization to improve how people feel today and also to set them up for the future.
So we're a team of planners. We have a family office, and so we're very focused on planning. And so in terms of physical, mental, and financial planning, the concept of planning for your health, how do we go about doing that, and how do we make it less daunting?
Sure. Yeah. So really, just like with a financial plan, in order to create a plan for your health, it really starts with understanding where you are today.
So like a benchmark.
Totally. Yeah. And so when patients come through the clinic, you want to do a few things. You want to look at what their lifestyle factors are, how they sleep, how they eat, what their exercise routine looks like. You want to do a more in-depth assessment of their labs, which can include supplements and hormones. And by creating that base, you have a much clearer sort of integrated picture of how that patient is doing today. And once you have that picture, then it's much easier to get a sense of what their goals are and where they're trying to go. Just like with financial planning, I think one of the really big reasons that patients can come through the clinic, get a baseline assessment, and then maybe not get to where they're going is they don't have their goals, and they don't have a core group of people to help them achieve those goals. Mm-hmm. And so in very similar fashion, like, it really starts with a clear benchmark, a clear understanding of what their goals are, and then guiding them through that process.
Right, so having an expert in health is as beneficial as having an expert in finances.
For sure.
Awesome.
Yeah.
So full disclosure, Johnathan's been my doctor for 2 years. In previous conversations, you've hammered it into me that normal isn't necessarily optimal. Can you expand a little bit out on that?
Yeah, for sure. So, I think when what we've known so far in the conventional healthcare system is if you have a big red flag, those get picked up really quickly. But if you don't, if you only have some trouble sleeping, some increased anxiety, some difficulties maintaining your weight, unless it's pushing things to a lab value that's so bad, it doesn't get triggered. Nothing happens. Mm-hmm. But the truth is, we have so much data and so much evidence around ways to improve people when they're just feeling like a little bit off, to support their health, that we just need to implement. And the normal thinking has been for the past 50 years that, oh, well, I'm just getting older, these things happen and break down, and patients and people have to struggle with these day-to-day issues. That is the consensus, but that's not actually true. There's a ton of things that you can do. The trouble is, in order to get there, requires a really integrative approach. Mm-hmm. You need to be looking at your lifestyle pieces, mm-hmm. right? So you need to be looking at your exercise, your sleep, what you eat, when you eat. But then also, there's all these other components around supplements and the evidence that supplements can support. And then lastly, you need hormone replacement for many patients. We used to think that men and women's hormonal changes as they got older was something that you just had to deal with. But we now know that that's not the case. So if you can integrate those things together, you can really sort of exceed expectations of what you'd expect for like the quality of your life in the day-to-day. But that's also not necessarily the norm of what you'd expect within the conventional care system at this time. So I imagine that financial planning is just about as much about avoiding pitfalls as it is actually like optimizing for success. Can you tell me a little bit about what a financial planner does in that way?
Well, it's very similar to what you do. Financial planning is gathering all the information, understanding what clients' goals are, coming up with that plan, and making sure that we hit those milestones in order to get the client to where they want to be. So in my mind, a financial plan is built so that a client can, they have all this wealth, which ties into how you guys come up with your medical plans to, let's say, enjoy that wealth. Like how do we get to that place where we have a plan so that my clients or myself can enjoy the wealth that we've been so diligent in creating?
Sure. Yeah, and I think medicine has some of those similar pieces, right? So when patients come through, they always have the major goals of wanting to feel better, to optimize, things like that.
Right.
But the truth is like there's a couple key markers where it's not just about trying to plan for success, it's also trying to mitigate the risks. And so, there's a few biomarkers that we'll look at. So number one is something called a fasting insulin. So just as a quick science note, when you need insulin to drive sugar from the bloodstream into the cell. So you have a piece of cake, you need to take it from the bloodstream and put it into the cell. Insulin is the thing that helps to do that.
Okay.
But if you have insulin, if you're constantly eating sugar or you're just genetically predisposed to diabetes, way before you'll actually see the sugar levels come up, you see the insulin levels come up. And so by testing for that, in the same way that you would look for small things, maybe it's changes in spending, or small things that you would say like, oh, this is nothing yet, but it could be a bigger problem.
Right.
A big part of the labs that we do are in that same way. So to try and prevent things from happening sort of before they actually grow into a substantial disease process.
So what you're saying is that we aren't necessarily a victim to our genetics?
For sure not. No, in the same way that you're not necessarily a victim to the habits that you have or the financial ideals that were passed down from your parents.
Yeah.
Right, which carry weight.
They do.
But the truth is everybody's got their genetic platform, their profile. The question is, what are the things that we can do in the day-to-day to optimize that for today to prevent those genes from taking advantage of your health in the future?
Awesome. So kind of like as a wealth planner, we try and mitigate risks on multiple different levels to ensure that we're setting our clients up for success.
Yeah, and it's not necessarily the sexy stuff that does that.
Yeah.
But it's often what generates the most wealth and the most health.
Okay, right. So Johnathan, when we build our plans, we simply ask our clients to dream and say, what do you want out of life? Like, what is it that you want? And it's always travel, being able to golf, being active with the grandkids and doing all of the fun, active things. How reasonable is it for clients or patients to think that's attainable?
Yeah, totally. I mean, I think just like with a financial plan, as long as you're following the steps, you can actually have like a wonderful life, whatever that means for you, right? On the health journey, the one area that always gets lost within conventional care is the importance of bioidentical hormone replacement as a part of that journey. So oftentimes, even up until maybe 3 or 5 years ago, women going through menopause, we thought it was just something that you had to deal with. Well, the truth is you don't. We know that all the sex hormones, progesterone, estrogen, and even testosterone, are really important for maintaining a life that is healthy and happy with balanced mood and lots of vitality. Similarly, in men, testosterone gradually declines as well, starting at like 1 or 2% after age 40. So being able to replace those levels to a healthy level is important for the things that we think about, which are like libido, erections, muscle mass, but also can have profound effects on mood, energy, and focus. And so I think a really big part of what we try and do at the clinic is we don't want to rely heavily on those as like the only option, but it's a really important piece to what helps to bring everything else together.
So that's why I'm always being told to eat more protein, work out heavier.
Yes, yeah.
All of those things.
Yeah. They release growth hormone and testosterone, which is really important for your energy and how you feel.
All right, Johnathan, so before we end it off, what is one main takeaway? Why should we care about taking care of our health?
Yeah, I think the big thing to understand is, in a better way than we have ever before, health is something that is within your control. We've always had this idea that health is something external. It's something that happens to you.
So you're being reactive.
You're being reactive. And that's the way our whole healthcare system is set up. So it's very reasonable to have that expectation. But the truth is, we have so much data, and there's so many levers that you can pull on to improve your health for today, that if there's things that you're hoping to do tomorrow and into the future, I think you should care, because you can do those things as long as you're thoughtful and productive of your health today, and as long as you've got a really clear plan about how you're going to reach those goals.
So in a sense, it's like compounding.
For sure. Like, the optimizing in any one of these facets, whether it's sleep, exercise, nutrition, supplements, or hormones, not any one of those individually is going to give you a massive impact.
Right.
But if you can get 1 or 2% here, maybe 3 or 4% there, and you compound those together and then compound that over time, you can really see some dramatic results.
So I kind of look at it, this is one of my most favorite sayings. How do you eat an elephant?
I don't know, Elese, how do you?
One bite at a time.
There we go.
So step by step. It's like investing. If you have $50, you should invest that $50. You don't have to have $50,000. Don't let it scare you. Just take the next right step.
Yeah, and those habits build as well. It gets a little bit easier to invest. It gets a little bit easier to invest in your health.
Yeah.
But you have to take the first step.
Yeah. At the end of the day, you're worth it, right?
Yeah. Of course.
Thanks so much, Johnathan, for being with us here today. I know that we'll probably have some more events coming down the pipeline with you, but I've really appreciated that you take the time, and I'll see you tomorrow.
Okay, thanks for having me.
You're welcome.
Take care.